Welcome. This is Brenda Charles Edwards, host of Seniors Matter. We are live every Friday at 12:30 p.m. Pacific Standard Time on www.rainieravenueradio.world. You can also listen to us on the Rainier Avenue Radio App and Alexa. You can view us on YouTube, Twitch, Facebook.com/rainieravenueradio.world/videos. Seniors Matter invites a variety of guests to discuss issues and activities that may impact the lives of older adults and their families. If you have any questions, please put them in the comment section on Facebook, or you can call 206-290-9685. There are commission positions available on the Mayor's Council on African American Elders. If you're interested, please contact Ms. Karen Winston at karen.winston@seattle.gov for more information. My guest today is Cathy Knight, the Division Director for Aging and Disability Services, City of Seattle, Human Services Department. Welcome to the show, Cathy.
Thank you, Brenda. It's a pleasure to be here. I'm really excited to be here with you today.
Well, I am always happy to see you. We have worked together for a little while, and there's so much that you have to say that I want to just jump right into it. So, Cathy, was it 2017 that I first met you when you first came to your new position?
That's right. I started in June of 2017.
Gosh, I can't believe it's been long. But yeah, it's a good thing because you've been working hard, I know.
Yeah.
So, what can you tell our audience about aging and disability services and what it means to be an area agency on aging?
Okay, I'm thrilled to I love to talk about the area agencies on aging. You know, they've been around for over 45 years all around the nation. I don't think a lot of people know about them. They came out of the Older Americans Act, which is a federal legislation since the 60s that really established services to support people to age with dignity in their communities. And so area agencies are a real important part of helping people do that. We are in the city of Seattle. We are a division within the city of Seattle, but in partnership with public health and with the King County Community and Human Services, we are three-way partnership, serve the entire county. And people say, well, that's kind of weird that you're in the city. But if you think back to the 70s, that's where the majority of older adults lived at the time. Seattle had the infrastructure and the commitment to really setting up services and meeting the needs of older adults. And we do that variety, many services come out of the Older Americans Act dollars. Most people think about nutrition, home delivered meals, community sites. We have caregiver support. We assist with transportation. We serve, over 45,000 people in the county each year through a variety of the kind of services we have. And we have a main number that people can always call just to find out more about what we do and the services we offer. Should I tell people that number? I'll probably say it several times.
Please feel free to say it as many times as you want.
Great. It's a toll-free number for Community Living Connections, and that's 1-844-348-5464.
Fantastic. So, Cathy, how does ADS support people and this is the BIPOC community, which stands for Black, Indigenous, and Other People of Color? I love these new terms that pop up.
I know. Now I hear BIPOC all the time, which I guess is a easier way of talking about the communities of color, the many diverse members of our community in King County that we serve and that are very important. And that's what makes our area agency, because we divide up the state. There's 13, and we're the one that serves King County, and we're somewhat unique in terms of the diversity of our population. And so we're really aware of the health and the socioeconomic disparities that many of our community members experience. We actually contract with a variety of community organizations that are embedded in those communities. They're trusted by the community members, and they help meet the cultural needs. You may have heard of the African American Elders Program.
Yes.
I hope people have. That's one of our primary providers for King County. We have Asian Counseling and Referral Service, Chinese Information and Service Center, India Association of Western Washington, the Korean Women's Association, CMAR. That's just examples of the kind of local agencies that are, very in tune with the needs of their community members. And their services can vary. There's a lot of health promotion, trying to help people access services, caregiver support. Some do food services. It really is we try to meet the needs of the different communities. And we also do provide support to some very vulnerable people who also are members of the BIPOC community through our contract with the state for Medicaid case management. In other words, they're folks in King County who live at home, but they have the same needs as folks in nursing homes. And we're really proud that we're keeping those folks safe at home. And those are other, members that represent a diverse community members.
So how can folks get involved in advocating for the well-being of elders from the BIPOC communities?
Well, you gave a perfect example when you talked about the Mayor's Council on African American Elders. What a wonderful organization. And of course, staffed by Karen Winston, who we know and love, and we couldn't do it without Karen. She's so
right.
And you've been our chair for a while, right?
Yes, I was. I just, my commission just ended, and I believe I was chair for 2 years, but I've been a member since 2017.
Yeah, well,
actually, 2017.
So it's just been a real honor for me to be able to be a part of those meetings that are monthly. The council meetings are monthly, and we just so appreciate your service, Brenda. You're going to be missed so much. I hope to continue connecting with you, but we really do hope that folks will be interested. It was established to advise the mayor and other local leaders and even the state legislature on issues that are relevant to people of African descent. And so we really want to represent that King County community. And as you know, some of your advocacy in the last year has been really important in terms of looking at priorities for low-income housing, the property tax relief. You've been
we got that through.
And that's wonderful to help people. The utility discount program. The organization was involved in some of our great community events like Memory Sunday that was done in conjunction with several churches. Your Legacy of Love annual caregiver conference for African American caregivers. Grandparents Day that we did in conjunction with the Northwest African American Museum. I think they call themselves NAM. There's just so many ways that the Mayor's Council on African American Elders is such a strong voice for that community and to recognize the needs of folks who are aging. So I'm sure hoping that we will have people listening today who will want to find out more about the Mayor's Council and get involved. And then another way is because the Mayor's Council works very closely with our Advisory Council for Aging and Disability Services. So that represents all of the communities in King County. And it's one of the requirements that area agencies on aging have advisory councils, and they play a very important advocacy role for us. So that's another way that people can get involved.
So I'm going to throw a plug for the Mayor's Council on African American Elders by saying it meets the third Friday of every month at 2 p.m. And once again, if you want more information, please email Karen Winston, that's Winston, at karen.winston@seattle.gov. You will be glad you did.
Yeah.
Okay, so now here comes the biggie, Cathy.
Okay.
COVID pandemic. How has this affected your staff and your clients?
Well, how hasn't it affected all of us, right?
Good question.
I think everybody could say that their lives have been so affected by COVID. But what it did mean is we immediately had to shift from, we go into people's homes, we do assessments. I mean, those folks that I talked about that are pretty vulnerable that could be in nursing homes if we weren't managing services for them. Well, we had to change everything. We're now all working at home. We're doing more like remote assessments, but we are able, we do have nurses that when we really need to get in to see folks, and they do have caregivers. We have caregivers that are paid to come in and help them. So they do have folks in their lives, but it has totally changed how we work. All of our staff, we have contract staff who manage all of the different contracts with our community agencies. So we've had to, really learn to use technology better. Now that we're all getting used to this virtual world, looking at each other in little boxes.
Yes.
And, so, we have to try to worry about people's Wi-Fi. Imagine families. I really worry for our staff who have young children, because trying to manage work with needs of your family, and you have kids in school and you have limited space, and it's been a real challenge for a lot of people. But I have to say, they have risen to the challenge, and the work continues. So we're doing that. We're still working with folks. We're trying to provide more services, meals being delivered to people at home since they can't come to the senior centers for meals. We have this fantastic partnership with public health that, as I said, has existed for years because they're a partner with the area agency. And because of that, we could immediately mobilize in terms of working with them, making sure people got information, get involved with the testing so people are where they could get COVID tests. As I said, meals, we shifted and are delivering so many more meals and groceries to folks at home because it's not safe for them to get out. I already talked about our case managers staying in touch with clients and keeping them safe. We've also really tried to look at the issue of social isolation. And exactly what you're doing now with folks with your radio show, that connection with people so that you're staying informed, you're staying connected. We shifted all of our, what we used to do as coffee hours to keep the community informed. Those went virtual. And that's been a really good opportunity for people who can do the online. We've got auto captions. We have multiple languages. You can do it by telephone. It's a way to help people stay informed and stay connected. And we had close to home and stories of health, tech, and resilience. And I do believe you were on a few of those shows, weren't you?
Yes, I was.
Didn't you? What were you talked about? I know you talked about Grandparents' Day, right? Was that one of them?
And then I had also talked about my work with AARP as a volunteer, and my own business, actually, as a notary public.
Which is very important.
Well, especially since the governor has deemed us as essential workers. And I in fact, tomorrow I have a loan closing for a lot of people are doing reverse mortgages because the rates are so low. And it's just so for me, it's been a good thing. I've been very busy.
I bet.
It's just amazing how this pandemic has affected every area of our lives. I want to throw out a quick free meal location for our listeners. Mount Zion Baptist Church on 19th and East Madison has meals that are prepared by Chef Alvin at Demetrio Jazz Alley, and they're delivered to us every Tuesday and Friday, and we pass them out, and they are free. And you should check it out, and especially if you are a senior, if you can get someone to come up there and pick up the meals for you, or if you need to have somebody pick it up for you and you're in the central area, give me a call or email. Well, give me a call, and then at the end of the show, and then I can see what I can do to help in getting one delivered to you, or 2 or 3. So if you're just tuning in, you're listening live to Seniors Matter with your host, Brenda Charles Edwards, on www.rainieravenueradio.world, your community radio station. We're here every Friday at 12:30 p.m. We're on the TuneIn Radio app, Alexa, YouTube, Twitch, Facebook, and you can also call us 206. Where did I go? Oh, yeah. 290-9685. I tell you, there's so many numbers here. But also, we give you information about resources that can benefit you and your family and your community. And speaking of community, do you have financial documents that you need notarized? Are you a senior that needs documents read to you for clarity or completion, but you don't know whom to call? Call me, Brenda at Black Orchid Notary, 206-683-2636. Tell me where, I'll meet you there. If you're interested, once again, in attending any of the Mayor's Council and African American Elders meetings, please contact Karen Winston at karen.winston@seattle.gov for more information. Now, back to my wonderful guest, Cathy Knight. Cathy, so, we were talking about how your clients are receiving, still receiving in-home services during this time. But have they given you any feedback on more, let's say, increased isolation, increased worry, depression?
Yeah, those are definite issues I think, for not just the vulnerable clients we're serving at home. I think a lot of our community members are feeling that. In some ways, the folks that we are serving that have nursing home level needs, because most of them do have a caregiver coming in, they at least have a connection. I really worry for many of our community members who are used to getting out, going to the senior center, going to the library. So we're really trying to pay attention to that. We're proud that as I said, the folks who are at home instead of the nursing homes, we are seeing much lower cases of COVID, fewer deaths. I know it's such a tragedy that King County, 60% of the COVID deaths were due to folks who living in long-term care facilities. Yeah. So we see our services even more important during COVID and trying to help people stay safe at home, although it's a more isolation issue. So that is something we have to be aware of. And just the challenges of, we all have to remember about wearing masks. And, when the caregiver comes in, everybody has to be really careful. We don't want to be bringing the virus to people. But I'm just so pleased that we've kept people, I would say, very safe during this time.
So the governor has now said those 65 and up are moved into 1B for the vaccine. Why should someone get a vaccine, and is it safe?
Well, I'm glad you're talking about the vaccine, because we have gotten involved. Aging and Disability Services, we're working with the mayor's office. We're working with public health. We're going to help get that vaccine out to as many people as possible, as quickly as we can, recognizing now that individuals 65 and older and people 50 and over in multi-generational families, we need to get those folks vaccinated. And I truly believe that it's safe. I've talked to enough people who've taken the vaccine, and I feel that it's just so important. I've heard very few side effects. In fact, I think that because our immune systems are, as we get older, are not quite as strong, some folks are feeling like, it's not like activating things. So people are not having as many side effects, but those that are, they haven't been major. So we just encourage people, if you can get it, and we're still struggling to get enough doses, that's the big issue now, but we are really working hard to find ways to get it to people. I encourage everybody, get the shot, get both shots. It's that whole, it is true. We have to, the more of us who are vaccinated, the better we're off, because we aren't spreading it. And that's how we'll get a handle on this on this virus.
Right. No, I know what you're saying. And when we were talking about, where do you go? I received, was it from the UW Medicine, that their clinics are now getting the vaccine. Of course, you have to call and make a reservation to get the vaccine. But, at least it's being a little more widespread. And I was in a AARP call this morning, and they were talking about how there's also pop-up stations that are going to be happening with the vaccine. The
Yes.
only thing I say with this to everyone is, and this is coming from my fraud hat, is that if anybody tells you that you can get ahead in the line if you pay so much money, or anything that says you have to pay money, please
Right.
do not do it, because it's a scam. And
Yeah.
I know I, for one, don't like standing in lines particularly. That's why you can make reservations. But just know
Yeah.
that when somebody tells you something, when it comes to you have to give money, it is not a good thing.
I think I'm so glad you said that, Brenda, because it's so sad whenever something bad happens that scam artists take advantage of it, because you're right. You shouldn't have to be paying for anything. There are ways to get reservations, because you do have to usually make an appointment. And, if you have a healthcare provider, that's a good place to start, to just find out when you can get the vaccine. There are all these online ways if people have access. There's a thing called findyourphase.org
Right.
that
I did that one. Yes.
you can go and sort of find out when you're eligible. And I just have to say, things are changing every day. And even today, I saw information coming out from the city and the county. There's so much work being done to try to get the vaccine to people. Just like you said, some of the pop-ups will be working with senior centers, other community sites. We're going to try to find ways to make it as easy as possible for people to get, if they don't have a provider to go to, or there's not doses available, like you said, through that are being available through the university, that they can go to pharmacies. There's all kinds of ways we want to make sure people get the vaccine as quickly as possible.
Yes. Oh, there's just so much better. I hope that 2021 is going to be a better year for us. But having said that, and we're about ready to wrap up, but can you talk about the challenges that ADS is facing for 2021 and beyond?
Absolutely. Yeah, you're right, Brenda. Our hope is that by this summer, we'll have enough people vaccinated in this country that we will start to be getting a handle on the virus, but it still can be transmitted. We'll still need to be cautious. People will still need to wear masks, practice social distancing. We're all going to have to until the governor basically says it's all clear and things to go back to normal, we have to continue to operate like we're all doing our part to make sure we're not, just because you get the vaccine, you don't get sick, but you can still infect other people. So
that's a good, I'm glad you said that, because I was going to ask you,
right,
how does that work? Okay.
Right. So my understanding is the value of the vaccine primarily is that when you're exposed, you're not going to get sick. And that's why 2 doses are important, because that second dose protects you even more.
What's the time frame between doses, Cathy? Do you know?
Well, the 2 vaccines that are available now, one of them it's 3 weeks apart, and another one it's 4 weeks apart. So, and that you'll get a card when you go and get your shot, and you'll know when you're supposed to go back. But it's great to have the vaccine. We still have to be careful around one another, because we can still be spreading the virus. And, ADS, like everywhere else, it's going to affect how we go back to work. People will have to work in different ways. We'll have to use our space differently for a while. Many people have adjusted to working remotely and can, for those jobs that we can do. I think we're going to see that happen in industry. We're going to see that everywhere, that it's going to change some of how we do work. But we're also always needing funding. I hope that we are going to receive some additional funding from the latest congressional COVID relief package. And it's going to primarily help us again with food services, because that's what people need. They need to make sure, we got to make sure that people aren't going hungry during this time. So we're gonna continue to tell our legislators, we know we're in a budget crisis, but we need to continue to fund these important services. We need to try to improve digital equity. Too many people don't have access to the internet, and we're looking with legislators at ways to try, because that definitely affects disproportionately many of our BIPOC communities. Affordable housing is going to continue to be a big concern. Thank goodness people, they're holding firm on the rental, that
Oh,
they
right.
evict people. That's good.
But you know what, though, Kathy, on that piece, I hope that they're also going to help the people that have to pay the mortgages on those places that they rent out, because it's not fair for them to have to suffer and try to come out of their pockets
Absolutely.
to, make the mortgage payment. So
Yeah.
it's a twofold thing. It's not just for the renters, it's also for the owners of the buildings.
Absolutely. I think that some of what's covered, what it looks like is going to be in the upcoming COVID package, that and some of the things that the new president wants to do, where I think they're aware of those needs, and we'll hope, we're going to see better times ahead for everybody.
Right. Oh, I tell you. So, Kathy, it's time to say where our listeners can get answers to questions about local aging or disability services, and how do they get access to those services. I know you have a phone number.
Yes, I do. So, and people who like to do things online, you can also access us. It's Community Living Connections. I know it's a long word, communitylivingconnections.org. So people can just go online and you'll see places where we have resources, numbers to call. But the toll-free number that anybody can call if you have questions about aging or disability issues is 844-348-5464.
Thank you, Kathy. And thank you, everyone, for listening. It's been great having you on the show today. Be safe, live your life like it's golden, and the coronavirus update is next. Bye, Cathy.
Bye. Thank you so much.
You're welcome.
With you.
I love you.
Love you too.